Hello, everyone. Hope you're all well. Welcome to our YouTube channel. I'm Himanshu Borse. I'm a consultant in the reproductive medicine in London and Hertfordshire. So, today we are going to talk about basic semen analysis. It is the first investigation needed for a male partner. So, you need to take an appointment with the lab or it will be arranged via your GP. You need to follow the strict instructions and then the sample is analyzed and the results are given out. So the instructions, you need to make sure what time is your appointment. You need to be aware of making sure that the abstinence for at least 2 to 5 days. The simple reason is if you have ejaculated in less duration than that, that will have an impact on your sample analysis. The production of the sample is certain clinics available on site, or sometimes they ask you to produce it at home and then bring sample to the hospital. So you need to clean your hands and penis with soap well and dry it properly, and then you produce a sample by masturbation. Lubricants or regular condoms are not to be used because they contain spermicidals, which will negatively impact the result. And if the sample is produced at home, you need to keep it warm by keeping it closer to the body, like in your trouser pocket, and bring it to the lab on time so that the results are not affected. You make sure that the sample is collected in the container given to you, because these containers are sterile, and try not to use any other container at home or some takeaway container. If a hair falls in, there is no need to remove it as it will contaminate the sample. You need to close the container tightly and put your details on and keep it warm while you're bringing it to the lab. Some men do experience difficulties in producing the sample, so it is better to inform the lab. In certain situations where men cannot masturbate, we do offer them special condoms where they can have intercourse, ejaculate inside the condom, and then put the condom in the container and bring it to the lab. Some diabetic patients will suffer from retrograde ejaculation, meaning the ejaculate is, instead of coming out, is going back into the bladder, where we have to ask them to masturbate, and then we collect the urine sample and try and retrieve the sperms from the sample for analysis or freezing if needed. So you need to inform the lab of the issue so that necessary arrangements can be made. If you think there are going to be any issues or difficulties, it is always better to discuss it with the embryologist or the lab team so that necessary arrangements can be made. And in certain cases, a surgical procedure may be required to collect the sample and freeze it if needed. So this is the WHO 2010 criteria for normal semen analysis. So the volume should be 1.5 mil. These are all lower limits of normal, so anything above that should be fine. Total sperm count should be 39 million per ml. The sperm concentration should be 15 million per ml. The motility should be 40% or more, but the progressive motility we are interested, and that should be about 32%. The live spermatozoma should be more than 58 million. Sperm morphology should be 4% or more. The pH should be above 7.2, and peroxidase positive leukocyte count should be less than 1 million per ml. If your GP had arranged the sample for you, then they should be able to discuss the result with you, or it is likely that the semen analysis was arranged in preparation for the appointment with the fertility team. So when we see you in clinic, we will be discussing the results with you and any further plan if needed. The results, sperm concentration, as we saw, the lower limit of normal is 15 million per ml. So if it is between 10 to 15 million per ml, we call it mild oligospermia. Between 5 to 10 million per ml, it is called moderate oligospermia. Less than 5 million per ml, it's called severe oligospermia. And if you can't see any sperm in the sample, it is called azoospermia. The motility, if it is less than 32%, it is called asthenospermia. And if normal forms are less than 4%, it is called teratozoospermia. There are certain situations where all three parameters are suboptimal, count, motility as well as normal forms. So it is referred to as oligoasthenoteratozoospermia or OAT syndrome. And your fertility team clinician will be able to discuss these results with you and make a plan for further assessment as well as treatment options. And in certain cases, you may need a referral to the dedicated andrology team for further management. So, which are the factors which can affect the semen analysis? So, duration of abstinence, as we saw, if it is too small, then the counts are going to be affected, and that's why ideal abstinence is actually 2 to 5 days. The time of sample collection, we prefer morning is better, but it's not much of an issue. Recent illnesses or fever, which the effect is transient, although it can last a bit longer, so a repeat sample should be fine. Age, as the male age increases, the parameters can reduce, as well as there is an increased chance of DNA fragmentation. Certain hormonal imbalances which affect the sperm production will have impact on your results. Conditions like varicocele, hydrocele, hernia, because of the heat and oxidative stress, can reduce the semen quality, and certain genetic conditions may affect the results. Lifestyle factors like smoking, alcohol, anabolic steroids, high BMI, stress, lack of sleep, diet, and tight clothing, they all have impact on the semen analysis. So you need to make sure that you stop smoking, mainly not just for improving your semen parameters, but in certain cases or areas, it will affect your NHS eligibility for IVF treatment as well. Technical and procedural factors like incomplete sample collection or method of collection, delay in delivery, temperature during the transport, improper mixing, or contamination with lubricant. These all factors can affect, and that's why I mentioned earlier that it is important to follow all the instructions strictly and bring the sample properly to the lab. Certain environmental factors like toxins and pesticides, radiation and chemotherapy, heavy metals, and high temperature workplace affect your sample. So, our aim is that you understand the basic principles, you collect your sample properly, always have an open discussion with the clinical team. In certain situations, we do repeat the sample to confirm the abnormality and plan further management.